Alcohol use disorder content. As you can see in this list, we have history of alcohol, which will address the history, its origins, and history associated with addiction to or use of alcohol, including the legality of its use and societal issues. We have addictions, discusses how alcohol can create addiction, physical, psychological, including the risk of addiction to alcohol and statistics of addiction. Alcohol effects will address how alcohol works on the brain, including the neurotransmitter are affected. The street cost and names. It will address street costs of alcohol and common names of it, as well as withdrawal symptoms medication, which will address what medication can help with withdrawal symptoms. And at the end, we will have a couple statements.
Attention, attention. Here's the story of alcohol, and it all starts with rotten fruit. Imagine prehistoric times. Our ancestors are staring at some strangely fermented fruit. Doubtful, but one of them, more curious than the others, decides to try this suspicious drink. And what happens? They start singing like crazy, dancing like they're on Dancing with the Stars, and generally acting like they've lost their minds. Yes, my friends, that's the magic of fermentation in all its glory. Over time, people began to perfect this process, from primitive methods, like something out of Sesame Street, to ancient civilizations where alcohol flowed freely, all the way to modern distillation techniques that even Copernicus would be proud of. And let's not forget that alcohol is not just about having fun. For centuries, it has influenced culture, medicine, and traditions. So, next time you raise a toast, remember that it all started with a tiny rotten fruit. Cheers!
On this slide, we're going to talk about alcohol addiction. In an article from August 2024 called Stages of Alcoholism Early, Chronic, and End Stage, states alcoholism as a chronic disease, also known as alcohol use disorder, describing it as a severe and progressive condition defined by an inability to control or stop drinking despite the negative consequences. Some risk factors are listed as a genetic predisposition, environmental factors as peer pressure, cultural, and exposure, psychological factors as it could be anxiety, depression, or trauma. Alcohol abuse can result in several problems, including memory disorders, liver disease, high blood pressure, muscle weakness, heart problems, anemia, low immune system, disorder of the digestive system, and pancreas issues. As for statistics, we show on the National Institute on Alcohol Abuse and Alcoholism website shows that 16.8 million males ages 12 and older, 12.1% in this age group had a alcohol use disorder in the past year. For females, 12.0 million 12 and older had an alcohol use disorder in the past year. 757,000 youth ages from 12 to 17 had an alcohol use disorder in the past year as well.
The effects of alcohol. Alcohol affects many neurotransmitters, and in doing so, negatively affects the functions of the brain. So, what are neurotransmitters? Neurotransmitters, as explained by Cleveland Clinic, are chemical messengers that transmit signals between neurons, muscles, and glands. These neurotransmitters allow the brain to carry out many of its normal functions like heartbeats, respirations, the stress response, and digestion. They do this by being released from the presynaptic neuron in a vesicle into the synaptic junction to the receptors attached on the target cell. They bind to specific receptors, and it is here where an action takes place. Yet, alcohol can affect the excitatory and inhibitory actions of neurotransmitters. What are these? Excitatory are neurotransmitters that continue to send off its message to other cells, while inhibitory are neurotransmitters that stop the message from continuing to be sent off. So, how does alcohol affect this message carrier, neurotransmitters? Equilibrium between inhibitory and excitatory neurotransmission exists when no alcohol is present in a body system. However, the short term use of alcohol can cause more inhibition to occur. In an attempt to return to equilibrium, long term use of alcohol can increase excitatory actions. This is a major effect on the body's functions as the body can enter hyperexcitation with alcohol withdrawal syndrome. This can cause seizures and anxiety. With the short term effects of neurotransmitters, there's an increase in inhibitory actions. Glycine and adenosine are neurotransmitters that have this increase of inhibitory activity. There's also a decrease of excitatory actions. Glutamate and aspartate are those neurotransmitters that have this decrease. With the long term effects on neurotransmitters with alcohol, there's a decrease in inhibitory actions to compensate for the depressant actions of short term alcohol use. Then there's also an increase in excitatory actions. Short term effects on the neurotransmitters glutamate and aspartate. Alcohol causes the reduction of the excitatory activity of glutamate and aspartate. This means that NMDA receptors and non NMDA receptors are inhibited and sedation is more likely to occur. Glycine. Alcohol increases the inhibitory effects of glycine on the brainstem and spinal cord. This increase in inhibitory effects causes some of the behavioral characteristics of alcohol, like a lack of coordination. Adenosine. Adenosine, when the alcohol increases its inhibition, causes the body to be more uncoordinated and sedated. It does this as adenosine receptors regulate movement and memory. The stopping of the signal of memory or movement is enhanced with alcohol. The long term effects of alcohol on neurotransmitters. GABA transmitters are inhibitory and work to block signals from transmitting and to induce a feeling of calmness. With short term use of alcohol, the inhibitory actions of GABA receptors occur. This is because short term use increases inhibition. However, with long term use, the GABA receptors have a decrease in its inhibitory functions. This is because prolonged use of alcohol triggers excitatory actions of neurotransmitters. This increase in excitation causes inhibitory actions to be decreased, which means GABA receptors are depleted. This reduction of GABA causes anxiety and hyperexcitation.
In this slide, we're going to talk about street cost and names. Common names for alcohol. For beer, we have brew, draft, suds, cold one, etc. For wine, we have vino, grape, juice, merlot, red, white, depending on the type. For spirits, vodka, whiskey, rum, we have booze, hooch, moonshine, etc. These names can vary by region and culture, but generally capture the casual or slang way of referring to different types of alcohol beverages. For beer, typically range from $1 to $5 per can or bottle. For wine, prices can range from $5 to $20 per bottle. For spirits such as vodka, whiskey, or rum, prices can range from $10 to $50 per bottle.
Hi, so I'm here with Kelly Salvato. Kelly, who was an individual in your life that you have seen experience alcohol addiction, and how did that really start?
My first husband was an alcoholic, and I believe that his addiction started honestly when he was a kid. Um, he grew up in a very abusive home, and his dad was a drinker. None of his sisters or mom drank at all, but the dad did, and the dad was kinder to him.
Right.
And so I think that he just kind of drew towards that. So that's what he watched how his dad coped, and I think that's what he picked up on.
Interesting. And then how, with his alcohol addiction, did you see it take effect on his health?
He he coped really well for a really long time, and then he slowly started drinking more, and then and I know it started affecting his liver because his stomach got swollen or whatever.
Right.
And then I think it led into more harder drugs.
That's very interesting. Well, thank you so much for sharing with us. I know addiction is a very difficult topic to share, And I know I've had multiple family members themselves who didn't feel comfortable sharing statements. So we do appreciate you sharing the truth about addiction and what you had with it, as it does spread awareness about the disease. So thank you so much.
You're welcome.